Ultrasound machine. An ultrasound machine is a medical imaging device that uses high-frequency sound waves to produce images of structures inside the body. It's a non-invasive and widely used diagnostic tool in various medical fields, such as obstetrics, cardiology, and internal medicine. The technology is based on the principle of sonography, where sound waves are transmitted into the body and the echoes from different tissues are used to create real-time images. Key components of an ultrasound machine. Transducer. Pro. The transducer is the key part of the machine. It both emits ultrasound waves and detects the echoes that bounce back from tissues. It contains piezoelectric crystals, which generate sound waves when electrically stimulated and convert the returning echoes into electrical signals. The transducer comes in different shapes and sizes depending on the area of the body being examined. Central Processing Unit, CPU. This is the computer inside the ultrasound machine that processes the electrical signals from the transducer and converts them into images. It performs complex calculations and image reconstruction in real time. Display screen. The processed data is displayed as a 2D or 3D image on a monitor. The images can show real-time movement of organs, blood flow, and fetal development. Some modern machines also support 4D imaging, which captures dynamic, moving 3D images over time. Control panel. The control panel includes various settings that allow the operator to adjust image quality, depth, gain, and the mode of imaging, e.g., Doppler for blood flow. Transducer gel. A gel is applied to the skin before the transducer is used. The gel eliminates any air between the transducer and the skin, ensuring that the sound waves pass smoothly into the body for better imaging. How an ultrasound machine works. Transmission of sound waves. The transducer emits high-frequency sound waves, typically between 2 to 18 MHz, into the body. These sound waves travel through the body and are reflected back when they hit different types of tissue, organs, or fluid-filled areas. Echo reception. The transducer then receives the echoes reflected back from the tissues. The time it takes for the echoes to return and the strength of the echoes are used to create an image of the internal structure. Image creation. The ultrasound machine's CPU processes these echoes to form a real-time visual image, which can be seen on the screen. Differences in echo intensity, brightness on the screen, provide information about tissue density and structure. Types of ultrasound. 2D ultrasound. This is the most common form of ultrasound, producing flat, two-dimensional images. It is often used in routine examinations, such as monitoring fetal development or diagnosing abdominal conditions. 3D ultrasound. This technology creates three-dimensional images by compiling multiple 2D images taken from different angles. It is particularly useful in detailed imaging of fetal anatomy or tumors. 4D ultrasound. Similar to 3D ultrasound, but it shows a moving, real-time 3D image. This is often used in obstetric imaging to see the fetus moving inside the womb. Doppler ultrasound. This specialized technique measures and visualizes blood flow through blood vessels. It's used in cardiovascular studies to assess blood flow in arteries and veins, detect blockages, and monitor the health of the heart and vessels. Common uses of ultrasound. Obstetrics and gynecology. Ultrasound is widely used for monitoring pregnancy, including assessing fetal growth, detecting abnormalities, and determining fetal position and health. Cardiology. Ultrasound, specifically echocardiography, is used to visualize the heart structure and assess heart function, valve defects, and blood flow. Abdominal imaging. It's used to examine organs such as the liver, gallbladder, pancreas, spleen, kidneys, and bladder for conditions like tumors, stones, and cysts. Musculoskeletal imaging. It helps diagnose injuries to muscles, tendons, ligaments, and joints. It's often used in sports medicine. Vascular studies. Doppler ultrasound is crucial in evaluating blood flow in the arteries and veins to detect blockages, blood clots, and aneurysms. Guided procedures. Ultrasound can guide certain medical procedures, such as needle biopsies or fluid drainage, by providing real-time imaging to ensure accuracy. Advantages of ultrasound. Non-invasive and safe, ultrasound doesn't use ionizing radiation, unlike X-rays or CT scans, making it safer for regular use, especially in pregnant women. Real-time imaging, it provides real-time images, allowing for immediate assessment of organs, tissues, or fetal movement. Portable, many ultrasound machines are portable, making it easy to perform bedside examinations. Cost-effective, compared to other imaging technologies, ultrasound is relatively inexpensive and widely available. Limitations of ultrasound. Limited penetration, ultrasound waves cannot penetrate bone or gas-filled structures, making it less useful for imaging certain areas, e.g., lungs or intestines. Image quality. The quality of the image depends heavily on the operator's skill and the patient's body type, e.g., obesity can make imaging difficult. In summary, ultrasound machines are indispensable tools in modern medicine, offering a safe, non-invasive way to examine internal structures and guide various medical procedures. Advances in imaging technology continue to improve their diagnostic capabilities.